Hello, I'm Joe Semmes. I'm a family man. I'm a cancer survivor, at least so far. I'm a physician in the Portland, Maine area, and I recently spent 5 weeks as a patient in area hospitals. As a result of that, I've come up with what I see as the top 10 suggestions for seriously ill cancer or other patients facing a similar kind of challenge. So, as you know, with the top 10, we start with number 10 and we work our way up to number 1. Number 10, market yourself. You want to look viable. You want your providers to connect to you human to human so that they know your story, not just a disease process, and possibly know a little bit of their story as well. Wear clean clothes, your own clothes. A hospital gown not only looks pitiful, but it feels pitiful. Make eye contact. Have your physician sit down on a chair. Learn their names. In fact, know the names of everybody involved in your care. And that leads me to number 9. Know the players. This can be challenging in a teaching hospital where you have interns and other doctors in training, residents, fellows, then the attending physician, who's actually the doctor legally in charge of your care, but you may not see that person, he or she, very frequently. Sometimes they delegate a lot of the interaction to the doctors in training. But it's important maybe to have an advocate keep track, if you can't, of who's visiting, who they are, and especially to know who's in charge. And those are the doctors that actually write the orders that the nurses follow. Now, sometimes you'll be visited by consultant teams that have doctors that are very authoritative. They may see you frequently. Their ideas may sound wonderful. But sometimes they're just making suggestions, and the doctors that are in charge of you may or may not follow those. The other thing is that they may be leaving for a 3-day weekend. Try and find out when people are going to round, when these doctors will round, and when they're going to be gone, and who's going to be covering. And once again, learn the names of everybody involved in your care, not just the physicians and, of course, the nurses, but the nurses' assistants, maybe the housekeepers, and even the person at the end of that buzz button, the intercom where you're asking for help. That's a real human being who you'll see if you walk around the corridor, and it enhances the whole human-to-human interaction. Number 8, have an advocate. An advocate is someone who can be your eyes and ears, that can be present if you've been sedated, if you're recovering from a procedure, if you're overwhelmed with some of the information. An advocate can track options for diagnostic and treatment decisions. They can keep track of who's visiting, names. They can tell what medications you're receiving, what you're supposed to receive, and make sure that timing works. An advocate can ensure that your visitors wash their hands or use disinfectant to cut your chances of getting a dangerous infection. And also, in terms of communicating to family and friends, an advocate might be able to use a wonderful site called caringbridge.org, which is an internet-based site that can update family and friends and is free of charge. Number 7, prepare for the worst, but hope for the best. Many mature adults have wills, but not that many have planned their funerals. Well, I think it can possibly be done responsibly. It doesn't happen to happen next week, and perhaps you might have some joy and even humor in doing such a thing. As people with life-threatening illness look at the possibility that they may not meet their grandchildren, they may not be present for key events in their children's lives, one might consider doing something like what's called an ethical will, where you write letters to your survivors about what was important to you. What were the big watershed moments in your life? What are some of your most important memories? Otherwise, these may not be communicated. At the same time, we can hope for the best. And in fact, there are many cases of remarkable recovery and a tendency for physicians sometimes to talk about some of the more unfavorable prognoses. So sometimes a hospitalization is a lot like a battle. When the smoke clears, the results are different from what anyone expected. And sometimes they can go wonderfully. So be hopeful. And for that matter, if things don't go the way you're hoping and one does approach the end of life, it is possible to reframe one's perspective in such a way to have hope. Number 6, get a palliative care consult. Palliative care is a new subspecialty in medicine, and it's often confused to be the same thing as hospice care. Hospice is comfort measures only. It's for people who are not approaching any curative treatments. Palliative care can be thought of as appropriate for any complicated medical patient who one wouldn't be surprised if they died within a year. And that includes a lot of our feeble elderly. The palliative care team includes a physician, nurse practitioner, nurse, chaplain, social workers, and their expertise is in the area of coordinating care and improving communication. And improving communication can be very important in complex medical cases because there are many different consulting teams and specialists that come by. It can be very confusing. One can't be sure of who's making the decisions, and a palliative care consultant can help coordinate that communication. The palliative care team also has expertise in relieving discomforting symptoms such as pain or shortness of breath, nausea, even anxiety. They have a lot of expertise. So consider consulting your palliative care team even way before anyone's talking about hospice. Number 5, be proactively active. And that means sort of use it or lose it, or in other words, walk, walk, walk. Get up out of that bed and get moving as soon as you can. It's remarkable how quickly we're deconditioned in hospital beds. We lose muscle mass, we lose strength, and we're at risk for infections. One might even say that if you don't get out of that bed, you may not get out of that bed. So one can avoid some dangerous complications such as pneumonia or life-threatening pulmonary emboli by getting up, moving around, and expanding the lungs. So be active, get up and walk. Now, if you're an outpatient in the Portland area, the Cancer Community Center on Main Street in South Portland has wonderful free offerings such as Tai Chi, yoga, Pilates, including support groups. So very helpful in getting one active and back to a sense of fitness and wellness. Number 4, the family sort of becomes the patient. As one has a life-threatening illness or certainly approaching the end of life, the stresses on close family members, on the spouse and children can feel almost life-shattering. Profound threats to the order and their sense of how their life is structured. The timing of when these emotions can surface and how this is processed is highly variable, but it's important for the supporting network of family and friends to be attuned, to be supportive of each other, to listen well, and especially to support the spouse, who often is lost when the patient is so much a focus of concern. And professional help can be important and useful as well in this context. Number 3, And I don't mean to be Pollyannish here, but open your personal relationship with God. And I don't mean the God projected by some other people that doesn't at all ring true with you. It's certainly not the God that people kill innocent people for. But maybe the idea that things somehow fit together in a way that makes sense and is uplifting. And there are many signposts, there are many guides. Each path perhaps is unique, but there perhaps is a virtue in being open to the unexpected and to permit a softening in some places that are hardened. Number 2, look for the gift in the problem. Perhaps embedded in the dark cloud of heartbreak is a silver lining. And that perhaps is that for every sentient, conscious, feeling creature, we share this vulnerability. And it is this commonality and a shared love that supports us and lifts us through this that is perhaps that gift that's available to us at these times of stress. Number 1, choose love, not fear. Some years ago, my family and I visited an elderly cousin, a philosopher, and he greeted my young teenage twins with a, "Oh, hello, how do you do, you unique manifestations of the divine?" Well, in the setting of a life-threatening illness, what comes through the eye contact, the intentions, the actions, and the support of loved ones, of close family and friends, may well be a manifestation of that divine love. So, choose love over fear. So, there's my top 10 list for seriously ill patients. Thank you for listening.